Welcome back. So ahead of Thanksgiving, the province sending some mixed messaging here about how families should safely gather to avoid spreading COVID-19. Have a listen.
To having everyone over, your aunts and uncles, hang off on the hugging and the kissing and everything else.
Stick to your household. That's what we're saying at this point.
Okay, we should point out, though, Ford later clarified on Twitter saying that he and his wife will only have his immediate household over for Thanksgiving dinner, just them together. But what do the experts recommend? For tips on a safe holiday weekend and more, I'm joined by Peel's Medical Officer of Health, Dr. Lawrence Lowe. Good morning to you, Dr. Lowe.
Morning. Thanks for having me.
Thank you for joining us. So let's begin here with Thanksgiving, because a lot of people sitting here with this dilemma. What do I do? It seems like the message is clear, at least from the medical professionals, saying stay within your household. What do you recommend?
Well, as you know, we're seeing cases increase, not only in Peel, but across the province of Ontario. And so really, as we're seeing cases rise, the best thing to do is to shrink our bubbles or circles. And so really, at this time, we're recommending that you remain in close contact with people in your immediate household, as well as essential supports, which really means that if you want to celebrate Thanksgiving with a traditional dinner or banquet without any of that social distancing and masking sort of stuff, you'll have to make sure that it's pretty much just with your immediate household and one or two essential supports that might be helping out.
When you say essential supports, what are you referring to?
Well, we do recognize that not everyone has a family in their home. Many people live on their own, or many people need help with childcare or with an elderly parent. So if there's like one or two extended family members or close friends that are part of your day-to-day, then those people could be included in your celebration.
Okay, I want to be very honest with you. I know a lot of people who said, well, technically, I can still have 10 at any time indoors, as long as we're physically distanced. And a lot of people will likely do that. Many, I assume, will be taking advantage of the weather, with it being nice, as Frankie's been mentioning, and you can technically still have 25 physically distanced. If this was to happen, what are the tips then? Again, it's not recommended, but if people do that, what are some big tips on how to protect one another?
Well, the most important thing with any gathering outside of your immediate household and essential supports is to ask yourself three questions. First of all, is it really necessary? So whether Thanksgiving passes the test or not, I think I'd leave it to individuals to take that decision. The second piece is to identify if there's another way you can do it, preferably online or virtually. And certainly this will be my own virtual Thanksgiving. We'll probably try to Zoom in with my in-laws, with my parents at some point. But then if you are going to have people over, you really have to make sure that it is the precautions that you're following, that it is strict physical distancing, especially if you're indoors wearing a non-medical mask. And most importantly, if you're not feeling well, even in the slightest, you should probably stay home.
Very quickly, before I let you go, Dr. Lowe, for part one of our interview, you said last week Peel Region was not in wave 2, in the second wave. Where does it stand right now?
Well, it's really helpful for me to clarify that comment, because I think, a wave is an academic term. People are very focused on describing what they see. But the reality is that wave or not, Peel is actually still seeing high transmission and high case rates of COVID-19. Now, granted, most of them are limited to certain settings. But really, what we're doing in Peel, what we need to do in Peel right now is to step back from the precipice. And that's why we've got to make sure we shrink our circles and numbers to keep this thing under control.
Okay, Dr. Lowe, we're going to let you go for now. If you wouldn't mind just standing by, we're going to take all of our viewer questions, calls, and comments, and that's coming up in about 15 minutes' time. Thank you for doing that. Appreciate it.
Looking forward to it. Thank you.
Thank you. And Frankie, hopefully we can answer your question when it comes to school settings and symptoms.